feeling is very similar to March of 2020.
It's been nearly 2 years since the pandemic started, but it is starting to feel like things are kind of moving backwards. Places are closing, people are having trouble finding tests, and a record number of people are getting infected with COVID-19. The St. Louis Pandemic Task Force says it may only get worse before it gets better. Tonight, our Justina Cornell learns how hospital systems are trying to keep up with the surge and also how you can help.
The numbers do not lie.
1,213. That's the amount of COVID patients hospitalized in the region's 4 major hospital systems, a new record in this pandemic.
The number of people there in a hospital at any given time with COVID has more than doubled compared to, say, 2 weeks ago. And the number of new admissions to the hospital just in the past week has gone up by at least 40%.
The most recent task force information that we have is that 90% of our staffed beds are taken up and about 82% of our hospital ICU beds are taken up. That's really high right now, and we are not near the peak yet.
When do we expect to be at our peak?
When you look at those models, I think the most optimistic take is that next week would be our peak. I don't know that that is really quite right. I think we can expect a couple more weeks of kind of ramping up to the peak.
So if we continue at this rate,
within a couple of weeks, we'll probably double the number of patients in hospital in the region.
but our hospital systems are already stretched thin, with staffing shortages mixed with an influx of patients. To keep up, BJC Healthcare already cut off elective procedures this week that can be safely postponed.
Reducing the elective surgeries will helps open up some capacity because some of those patients will get admitted to the hospital.
Already adjusting is Barnes Jewish Emergency Department.
So we have to triage. We focus on those that are most sick and need us right now, today, and need interventions. We have to open up new COVID floors because we separate those that have COVID and those that don't have COVID.
As hospitals get more equipped for what's to come, health officials urge you to do the same.
Get vaccinated, get the booster.
It's really important that people do what they can to try and make this better.
Justina Cornell, 5 on your side.
In the 3 hospital systems reporting data today, 69% of patients are not vaccinated. And for the fully vaccinated patients, just 2% of them are boosted.